This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, well, good morning and happy Christmas Eve for everyone that's here. I didn't really have anything too holiday themed, but Medical Minute about family presence in resuscitation of cardiac arrest. So, I think it's something that we've thought about for a while, that families should probably have the option, if they want, to be there when, we're doing CPR on family. There's been a couple studies that have looked at it in pediatric patients, but this was kind of an interesting patient looking at it from an adult perspective. And it was kind of cool. They took EMS agencies and they randomized kind of the families of those in cardiac arrest to be offered to be there during the resuscitation. And they basically trialed either having them or encouraging them to be there, or kind of just the regular, whatever people were doing. And in the group that they tried to get there, about 80% of the families did witness or be there for the resuscitation, as opposed to about 40%. So they got a lot of people there during the resuscitation. And what they looked at was, did family members have PTSD, kind of more or less, or were they kind of anxious after kind of the fact, I think it was like 90 days later, did they have more or less PTSD? And they did find that the families that were able to be there for the resuscitation had lower rates of PTSD, lower rates of anxiety relating to kind of the arrest of their family member. And they did also look at, was there a difference for the providers? Was there a difference in outcomes? And there was not. So I think in general, I think it's a good thing to offer families to be there for the resuscitations if it's a possibility. One of the caveats is it's good to have somebody who's assigned to be there with them, kind of explain what's going on, not just have them standing in the corner having no idea what's going on. So somebody should be there to kind of offer them a seat, tell them what we're doing. And it really does, I think, offer good closure, just a kind of better experience for families to be there, to know how much we're doing, know kind of how hard we're working, rather than just telling them at the end that, the family member didn't survive. So any questions or comments about family member kind of presence during resuscitation? All right. Well, thanks, everyone. Have a good day.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.